Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome June Garen and Carleigh Beriont. June is a retired nurse and author. Carleigh is a local government official. And today's Kevin MD article is Violence Against Healthcare Workers. The Silence Must End. June and Carleigh, welcome to the show.
Thank you
Good
so
morning.
much, Kevin.
All right, so I'm just going to ask both of you to briefly introduce yourself, and then I'm going to go back to June to talk about the article. So, June, why don't you tell us a little bit about your story?
I am a retired nurse. I retired in 2025, and I had previously worked in both psychiatric nursing and in the operating room, and had been the survivor of a pretty violent assault in the workplace. Therefore, I ended up writing a book called Hey, I Could Use a Little Help Here. And that's where we had met previously, Kevin.
All right, and Carleigh, tell us a little bit about your story.
Yeah, so I am a mom of two. I am a former union organizer. I helped organize the graduate student workers at Harvard University, where I teach about US history and public policy. And I'm also a candidate for Congress in New Hampshire's first district, which is one of the projects June and I have been working on this year, helping people take better care of themselves and their families and what role government can play in that.
All right, so June, for those who didn't get a chance to read your article, just tell us a little bit about your story, what happened, and then the article itself.
Oh, I'd love to, Kevin. It kind of came from a visceral place because when I retired, I totally retired. Everything, I let everything go. I decided to put everything away, focus on things like knitting, gardening, the dogs. And then I started being more involved in politics and raising my voice to advocate for others. And one day I was on a meeting and heard that there had been a death in Minneapolis. Went sort of sailing through social media like we usually do when we're not paying attention to meetings that we should be paying attention to, and came across the actual video of Alex Preddy, who's a nurse, being executed, which sort of hit me beyond a visceral level. It was a sucker punch to my soul. And that's what I say in the article. This retired nurse kind of came back up and out and reared her head and said, no, we've got to start speaking up. I sit in a position of great privilege. I no longer have to answer to anybody. I answer to my own conscience now. I can speak up and I can speak out, but I need to have somebody listen to me. And that was one of the most difficult things after I was assaulted, was finding somebody who listened, which is why I wrote my book. And it just happened that I knew this wonderful woman who was running for Congress. And I said, okay, look, this is the deal. This is where you get to show what you're made of. You need to listen to me. Are you willing to? Because you need to step into this. Nobody's listening to healthcare workers, the boots on the ground people who are being hurt in the workplace. And that's where the birth of that blog that we submitted to you came from, on that very visceral level.
So, June, for those who didn't get a chance to read your article specifically, when you said that no one was listening to you after you got assaulted, tell us more. Tell us exactly what happened and who specifically you felt was not listening to you.
I think what happens is from the moment a healthcare worker is assaulted, and what I learned in the book from interviewing other nurses is that we tend to become not even a statistic, because many places don't even keep track of the statistics. You become almost a liability or almost a big shadow where you're forgotten, where you're sort of pushed into a corner at the edge of the herd, where somehow you're shamed, you're blamed, we're in the wrong place, you made a bad decision, this is your fault. Why did you do this? Your competence is called into question. You're gaslit almost with, well, we provided you with everything you needed. Why didn't you use it? And I saw that same sort of vortex whirling around that whole situation with Alex Preddy. Within minutes, social media blew up with those kinds of judgments. And I thought, this is just on a bigger level what we do to healthcare workers who are boots on the ground.
And Carleigh, when you first heard June's story, tell us what your first reaction was.
I was really horrified and just so grateful to someone like June for speaking out about her story. I think too often these kinds of incidents are treated as par for the course or part of the job, and people aren't given the kind of platform, especially people who are working really hard to take care of our most vulnerable community members right now. And so to me, I said this is a policy problem, right? There needs to be something that we can do at the federal level to ensure that we have nurses who are able to organize and unionize, who are able to have safe staffing. And this is something that affects not just the patients, but it affects the nurses and their families. Like June is a mom and her kids both work in healthcare. And I want to make sure that they're able to take care of all of the people in our communities who need that care, but they can't do it if they're like basically on the policy menu instead of sitting around the table right now, which is what's happening.
And Carleigh, you said that this is more of a policy problem. So, what's been done in the past and what is still lacking and what needs to be done going forward?
Gosh, so many things. And I think this is where, a campaign for Congress has really given me insights to this process and how we can organize effectively to build power. So, one of the things that's really awesome in New Hampshire this year is that we had our nurses form a union, which is one of the great labor victories that we've seen in a period that has not really been super conducive to organized labor. And what this means is that they can get together and they can force administrators to listen to their concerns and to institute all sorts of new procedures to make sure that they are safer. And one of the places where this comes up a lot has to do with private equity and bankruptcy protection. So in New Hampshire, we have 16 Genesis healthcare facilities, and Genesis was bought out by private equity a few years ago and has been going through bankruptcy. And we saw also a repeal of nursing requirements. And so instead of having a nurse 24 hours a day on staff, you only have one 8. And that leads to negative outcomes for the people who are receiving care there. And so it's all sorts of little parts of this process that you don't really know about unless you're actually spending your time listening to people like nurses like June and her family, listening to the patients in these care facilities, rather than spending your time as a politician listening to the lobbyists and the groups that have a lot of money that enable people like me to get into office and actually craft policy.
So, June, how pervasive of a problem is this? I know that you were so brave in sharing your story, but just speaking on behalf of your colleagues, for those who may not understand the scope of the problem, how common is violence and assault against healthcare workers today?
Well, I believe Massachusetts has actually just the MNA, Massachusetts Nurses Association, has just made a very visual display of how many healthcare workers are assaulted in a day by putting actual scrubs up on the steps of their statehouse. And it's not even the people who are reported, it's the verbal assaults, it's the threats, it's the shoves, it's just the overall lack of social contract to go into a place to be healed and actually be respectful. My son is an emergency medicine physician. My daughter is a social worker who works in the emergency room. I worry every day for them. They are on literally the front lines. And I never know what's going to happen because whatever was happening before comes into that environment. Whatever upset was happening in somebody's life comes into that environment. And I think about my kids, and they were all dewy eyed in the picture that I put in my book in the dedication. He was fresh out of medical school. She was fresh out of her MSW. And I wrote, "You are my gift to the world." And I still believe it because they're good people and they're compassionate and they want to do the right thing. And they're great advocates for their patients. But underneath their picture, I wrote, "May you always be safe."
Mhm.
And I worry about that. And I worry about other people's kids because you never know without that social contract when it's going to come apart, when somebody's going to show up with a gun. And you work under those situations daily. So it's
So,
not just the actual incidences, it's the anticipation of going to work and trying to do a job where you're healing people, knowing it could be the last day you go to work.
And June, after you were assaulted, just tell us from a personal level, how did that affect how you saw patients going forward? How were you able to go back to work after that incident?
I wasn't able to go back to the place that I had worked. I had been written out of there. I was retired on disability because I couldn't have another head injury. There was no guarantee I could recover from a second one. And it shifted my perspective of how I looked at people. I found that I was much more guarded, and where I had been fearless before, I stayed an arm's distance away. I was flatter, if that makes sense.
Mhm.
I was not as giving. My soul was like in a hard little case. I don't think I was as good of a nurse after that.
Carleigh, when you hear June's story and you're thinking about the policy options, I do have a lot of hospital administrators listen to this particular podcast. What are some of the message that you want to share with our hospital administrators to take the issue of violence against healthcare workers more seriously, or actions they need to take to protect the safety of our healthcare workers? What's the message you want to share with them?
Yeah, so I think the two things that I would definitely highlight right away are that it's important for us to sit with June's story and recognize just like what that does to somebody who is providing care for so many other people. And also know that this is something that is so common in healthcare right now. And I recognize the incredibly difficult position that so many of our hospital administrators are in. I've held a number of roundtables where I've brought together people from all levels of the care system, from nurses to people who work in billing, to people who are administrators, doctors, surgeons, to actually sit together and have a conversation about what are the things that they wish politicians understood better? Why is it so hard if they're spending so much time on paperwork? What's getting missed right now? And one of the big things that constantly comes up is just the costs, right? The high cost of keeping our healthcare system going right now. And there's bipartisan legislation that can help us address the workplace violence that we are seeing. So one of the pieces of legislation that I would be really excited to champion in Congress next year is the Workplace Violence Prevention for Healthcare and Social Service Workers Act. And it requires the Department of Labor to address workplace violence. And it requires employers to take efforts to really protect people and to educate them and to keep them safe and to let people process the kind of incidents that are all too common right now. But one of the challenges and impediments to getting this type of legislation passed and implemented is the cost. And so I want people to know that we will find the money to ensure that the people who are taking care of our friends and our neighbors and the most vulnerable people in our communities, so that they can do that. We will find that money, and we need to agree that this is something we need to invest in right now.
And Carleigh, when it comes to costs, we already know that healthcare is buckling under runaway healthcare costs, and asking them to spend more on
Yeah.
something sometimes obviously is a hard ask. So, of all the other asks of our healthcare system, tell us why this one takes precedent.
Well, I come at this as the person that I am, right? So like I'm a mom. I know that if I can't take care of myself, I can't take care of my kids. And if we don't take care of our nurses and our doctors, then they can't take care of us. And this is something that we need to invest in right now. Like one of the reasons healthcare is so expensive, and like I fully get this. My husband's a public middle school teacher. He got a 3% raise last year, but our healthcare costs went up 15%.
Mhm.
And in local government, I'm on our budget committee, and I know that the cost of healthcare is bankrupting our communities right now. And it's not because we're providing great care to everybody. It's because of corporate monopolies that own our doctors and our insurance companies and our pharmacies and our hospitals and take a cut at every step of the way. And so, just as I think there is a lot of increasing consensus around this idea that we need to really prioritize taking care of the people who take care of us, we also recognize that in order to get the money to do that, we need to take away some money from some of the other places, whether that's cutting into corporate monopolies or taking some of the money that we spend on things like war right now and bringing it back to the United States so we can take better care of people here.
We're talking to June Garen and Carleigh Beriont. June is a retired nurse and author. Carleigh is a local government official. Today's Kevin MD article is Violence Against Healthcare Workers, The Silence Must End. Now, I'm going to ask each of you just to briefly close with some take-home messages that you want to share with the Kevin MD audience. June, why don't we start with you?
Oh, Kevin, I just hope that we can make a shift, and I hope that leaders will start to listen. That would be my goal. And I hope that maybe there's some other old dragons that are going to wake up and listen to this podcast and maybe be inspired to read the article. And some of the old folks like me will start to move back into being radicals and shift some of the energy in healthcare to advocate, because there is nobody in this world who is not affected by healthcare.
And Carleigh, we'll end with you. Your take-home messages.
My take-home message is just thank you to June for being so willing to share your story, and not just that, but being willing to organize around it. So we need leaders right now who can listen to us, the people who are doing the hard work closest to the problems, and then move that up the ladder so that we can enact the kind of policies we need to take better care of ourselves and the people around us. So my closing message is just that this is possible, right? When we listen to one another and we work together, that is how we build power, and that is how we make change. And we have so much power. People like June and her family and all of the nurses and doctors out there are the people who help us take care of one another. And we need to learn from them right now so that we can take better care of ourselves in this country.
June and Carleigh, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you, Kevin.
Thank you.